You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. Welcome. I'm your host, Angela Dea. These days, our social media feeds and television screens are flooded with images of them. Their faces are hard to see as they're covered by masks and shields. Some of you know them as family, as friends, or colleagues, but we all call them heroes. They're part of the Blue Army, the men and women in healthcare who are on the front lines of the COVID-19 pandemic. On this episode, we introduce you to one of these heroes. His name is Manar Alshahouri. He's a Prevea Health critical care and lung doctor who's been caring for patients hospitalized with COVID-19 at HSHS St. Vincent Hospital in Green Bay, Wisconsin. Before we begin, we'd like to note two things. First, patient privacy is a top priority for us at all times, and this discussion does not relate to any specific patient or patients. Second, this recording is taking place on April 16th, 2020. Everything's been so fluid through this pandemic and things are constantly changing. So we want to share the recording date with you to help add some context to this discussion. So let's begin. Dr. Alshahouri, I first want to thank you for the time that you're sharing with us today.
Oh, no, thank you for having me.
I've known you for quite some time. My hunch is that when I just singled you out as a hero, that likely made you feel uncomfortable. I'm guessing you'd say that the work that is being done right now to help patients battle COVID-19 takes teams of heroes. Am I right?
You're absolutely right on all counts. Yes, definitely. Dedicated, incredible teams of people.
Can you talk to us a little bit about those teams and, the respect I imagine that you have for your colleagues right now during this time?
It's been really. Frankly, I'll just start off by saying this. I'm not surprised. I'm not surprised by the courage, nor am I surprised by the dedication of my colleagues, both nurses and physicians. I truly am not. I expected no less, and I'm just in awe of all of them. Their focus right now is how do we beat this thing? How do we help those patients? What can I do? How can I be useful? And what is my part in this? And that's what it's been. I'm not surprised, but I'm in awe of all of them. This brought a lot of us closer. You get to know people. You can know somebody for decades, yet you can only truly know them in a time of hardship and how they conduct themselves. And I've gotten to know a lot of people even better, much to my very pleasant, I'm not going to say surprise, but to what I expected. I think they're wonderful. This brought a lot of us together. Brought competitors in our industry together. It brought ICU docs from all over this part of the country. And I can tell you more about that if you like. It brought the nursing staff, physicians together. The only you talk about how we all are kind of wearing our PPEs. The only way I recognize those nurses right now is I've known some of them for like 14 years. It's that time I've been here. By the way they walk, of course their voices, because I can't see their faces anymore. So it's been interesting.
Before we hit record on this episode, because we always like to go over a little bit of the outline before we hit record on these. And you were talking to me about the respect you have for the nurses that you work with. Can you talk to me a little bit more about that?
They're magnificent. These ladies and gentlemen, they go into these rooms taking care of those patients. Business as usual. Of course, it's not. But they do their job, and they do it well. And they go in there, and they treat those patients in there with great deal of respect. And they treat them like human beings, not as the as carriers or potential carriers of this disease. They show compassion for the patients. They've shown compassion to their families. Now, mind you, and I know most probably our listeners are aware of the fact that we're not allowing visitors, period. So they go their extra length of conveying some of the personal touches they're seeing in there to the patient's families, trying to be their eyes and their ears to kind of convey what's going on in there, because those poor family members, they are unable to see their loved one. And they're in those rooms all the time. And being in one of those rooms, it's a personal risk. Make no mistake about it. Probably everybody listening probably has heard about the higher level of infection amongst healthcare providers. Well, why? Because they're right there. They're exposed. And I admire them for that. I have a tremendous amount of respect for them. I'm not surprised. I've known most of these ladies and gentlemen for many, many years. And they're in there. They're doing their job like this is just another day in as far as how they care for people. But make no mistake, nobody's reckless. Everybody's well-equipped. Everybody's careful. But they just, they're doing their job.
Generally speaking, what are you seeing in terms of how this illness is affecting patients who need to be hospitalized for COVID-19?
This is an interesting it's an interesting illness. And I use that word kindly. It is a horrible illness. It can be very devastating, without a doubt. We've seen it in action. We've seen what it can do. It's methodical. It's a brand new disease, frankly. One of the physicians who I have great respect for. He's a luminary of lung medicine and ICU medicine, and his statement that rang very true for me is he said that there are no experts in this disease, none, and his point is well taken because this is a brand new disease. We are all learning, we're all exchanging our ideas, our experiences, and how to deal with this and how to treat this. This is a brand new disease that presented with what otherwise we thought is a familiar foe, but it turned out to be something very different. Medically, very, very different, without a doubt. And this really is now shaping how we deal with it and how we treat those patients. We're learning a little bit on the fly, but also very very intelligently. I think we're able to exchange our experiences very rapidly because of social, not necessarily social media, but the connectivity that we have with each other. Webinars where we can meet with world leaders and thought leaders in some of these fields. Twitter, believe it or not, I know people would deride it, but it has enabled me to connect with a lot of ICU docs and around the world and exchange information. It's totally very different.
If you're willing, can you take us for a moment inside your mind, inside your heart? Tell us what it's like to be there, to see patients firsthand who are affected by this.
It's a mix of feelings, frankly. Most physicians, I think all physicians are at their heart are curious scientists, if that makes any sense. And this disease, I'm very curious about it. It is, and don't get me wrong. I mean, I'm not looking at those patients and thinking, how interesting. It's truly just absolute curiosity as to what this thing is and what it's doing to us. This is now mixed in with definitely a sense of trepidation and fear. Make no mistake. This is a killer. A sense of humility, I think, because here is this thing, this something that we can't even see with your own eyes. Nothing new in medicine, there are a lot of killers out there that we can't see with our own eyes. But this thing brought the whole world to a halt, to a grinding halt. We're all stopped. All countries, all nations, everybody. Humanity spends a lot of time combating imagined enemies and doing so much to to prevent this imagined enemy from manifesting. Yet something like this has had far more effect and devastation than anything else. But also, it also brought us a lot closer together, if that makes sense to you. So it's a mix of things, At a personal level, when I look at a patient, and my overriding feeling is that I want to help this person. This is my battle with this virus right here. This is my battle. This is my hill, and I'm going to hold it. And I think of each and every one of those patients as a front line, and I need to defend this position, if that makes any sense.
Absolutely. You just were speaking about the fact that you have colleagues across the country, across the world, who are on the front lines of this pandemic. Can you help us understand the kind of emotional impact that this is having on them, on our healthcare heroes here?
It's been a lot of strain, a lot of stress, without a doubt. I mean, we're all human. Most of us have distanced ourselves from our families, our children in particular. I know my partners. Myself personally, I haven't seen my child in about 16 days now. I don't know when that will be over. Some of the Italian docs that I've been in communication with, one of them in particular, had said the other day that was the first time him seeing his family in 7 weeks. It's been tough. It's been tough psychologically. It's definitely been demanding physically as well for everybody. I think so far here we haven't had it as bad. We've putting in a lot of hours for many reasons, and taking care of these patients is definitely laborious. But my heart goes out to those docs in New York and what they're having to go through. The ones before them in Seattle. Most certainly the ones in Italy and France and Spain. It's been really tough. But you know what? It brought this a lot of strength. And these people are strong people. And they rose and they're meeting this challenge.
We're seeing our local community members and businesses really stepping up to support healthcare during this time. We take walks around our neighborhood. The driveways are covered in sidewalk chalk with, messages of gratitude and hope. There's blue ribbons hanging on trees, blue lights lighting up local landmarks, those paper hearts covering windows. You see businesses donating services, products, meals. So many seamstresses out there working around the clock, making cloth masks. What's your reaction to all this?
Gratitude, lots of gratitude, a lot of appreciation for it. On my way home, I just, I basically kind of just travel from homework, etc. And I see this on my way. There's one particular place here just down the road, and they have this sign across all the windows at the front, so you can read it very clearly. And they have a very large blue ribbon around a massive tree trunk, which is I love that. It's just a lot of gratitude. Thank you.
Yeah. No, we thank you. None of us have ever lived through a pandemic. I don't think that the majority of us, especially those of us who aren't in healthcare, would have ever expected something like this. What kind of impact do you think that this is going to have on humanity, on the world going forward?
You know what? That's a really interesting question. And since I've read it, it's something I've been thinking about for quite a while, actually. So it's interesting that you ask it. I think only time will tell. It could have it certainly could have a negative impact. With human nature tends to want to survive, and human nature, for us to do that, we typically like to find a visible enemy. So you'll find some negativity. You'll find finger pointing. You'll find blaming. You'll find racism, xenophobia, etc., etc. But having said that, there is also an incredible surge in coming together and recognize this that this is a threat to humanity, and it brought the best of us in so many ways. And also, this is it's interesting. America, in my adopted country, so I always think of America as the comeback kid. It kind of almost enjoys at times, getting beaten in the first round only to come back roaring. So here we are. Ford Company partnership with GE Medical. They're making vents that could be deployed in the field. They're making massive amounts of those. Things like you mentioned earlier. Even grandmas and people at home sewing things and kind of having some ingenious ideas. Those masks, if you ever wore one, they become intolerably uncomfortable on your ears after a little while. So we've been gifted with these head caps that have these buttons on the side that takes the pressure off your earlobes. It's actually amazing. It's just so much. I think globally that going forward, I think two major things will happen. On the one hand, I think this will change any government around the world will have to budget and consider this a non-negotiable part of its budgetary concerns and planning to be able to handle a pandemic. This is something that, fortunately, these things happen about a 100-year cycle. Sometimes 50 years, not as bad, but definitely with 100 years, there's always something major going on. And of course, humans, we have short memories, so we tend to forget about that. But I think with this, going forward, this will be a subject matter to be discussed and to be prepared in terms of PPEs, in terms of ventilators, in terms of whatever have you. This will be a non-negotiable part of any sort of budget going forward. And I think it'll be at the forefront. I think this will become a national security issue. And I think that's a positive thing. A lot of epidemiologists, a lot of physicians, a lot of people in the field have always advocated that it should be, but it unfortunately always took second place even farther down the list for various considerations, because it was never perceived as an imminent threat. So that's one thing. I think the other thing that's probably is likely is going to come out of this, and likely with the deployment of things like AI, is the ability to predict this very, very quickly and have a plan to enact equally quickly. The world is very, very connected, and unfortunately, this connectivity allowed this virus to spread so quickly. But at the same time, that could really work to our advantage in being able to have some early detection system, something akin, maybe even better than the systems we have there to detect tsunamis and earthquakes, etc. So that's what I'm hoping will happen here. And of course, having the ability to ramp up the vaccine industry, and that's a whole different topic. To be able to, now you keep hearing about that it's 12 to 18 months. There's a reason why that is, and the reason is partly bureaucratic, partly is inefficiency in some scientific methodology. But I'm hoping that some of these things will be addressed, and I think they will be, that we will move forward and past this.
So, when you look at what is being done now to help curb the spread of the virus, the staying at home, the social distancing, do you think that it's working, at least here in Wisconsin?
I absolutely believe it's working, without a doubt. And I would like it to continue. I know today Governor Evers came out and I think extended it till, please tell me, was it May?
May
I think May
26th.
26th, yep. I think that is definitely the smart thing to do. People have to remember that we haven't conquered this thing. We've flattened the curve. Yes, we have most certainly have done that. But we don't have a vaccine for this yet. This thing could still make a resurgence if people started getting back together. So it definitely is working.
Just a short while ago, because you just mentioned Governor Evers made the announcement extending the stay-at-home order. And I'm scrolling my social media feed, and so many posts seem to express frustration with this. People seem to be getting restless, frustrated that we're still being asked to stay home, that so many businesses are being affected. There's concern for the economy. There are others who are not taking social distancing recommendations seriously enough. And I guess, what are your words to those, and what is your take on this?
So there's a very rational take on this, which is the obvious. There can't be an economy without people. And for you to have people, you have to have healthy people. So the business right now is health. It's plain and simple. It's health. And for anybody to ignore that, it is rather ridiculous, because how are you going to conduct a business and economy if people are sick? What happens if you open up the economy? And I'm not a politician, so I'm gonna stay out of the politics of all of the above. But just medically and epidemiologically speaking, we don't have a vaccine. We don't have an effective treatment. This is a deadly disease when it gets bad. It has shut down businesses, has shut down countries and economies. So the business should be the business of health here, nothing else, till we are able to truly prevent it through a vaccine or some other methodology. Now, having said that, that doesn't necessarily mean that there could be local and very well-judged introductions of businesses, etc. But that has to be led by scientific knowledge and by infectious disease specialists and epidemiologists based on hard data, and not based on economic numbers. I'm sorry, that's how I feel about it.
Mm-hmm.
And I think that needs to be understood, because all of the measures that we've done thus far are going to be to no avail. Now, think of this as a souffle. If you're going to keep opening the oven, souffle is going to go flat.
Mm-hmm.
So just let it cook. Let it take its time. When it's done, it's done. And please stay home. Help us save our lives. We would really appreciate that.
And I think really that at the end of the day, that's the message.
And frankly, Angela, here's the thing. People are at home right now with their children. The schools are closed. And people right now are very worried, and they should be. So if we're going to talk about opening the economy, then you're going to have to convince people that they're safe. You have to convince them that it's safe to open the schools. You have to convince the teachers it's safe for them to show up for work. And you got to convince the parents that it's safe for them to deposit their children in their schools and then go to work. Think of it this way. How many of us have had children sitting in a daytime or a daycare or at a school, and how many of them came back home with snotty noses, etc.? All of them come back with these common colds. Common colds have an incubation period of less than 48 hours. This virus has an incubation period of 5 days plus. So people know all of that. So what do you think? What do you think? And I'd like to think there's a lot of rational people out there. So when politicians, etc., talk about opening the economy, are they really going to convince the parents, the teachers, all these people out there that it is safe? What has changed? I would ask this question. What has changed to make us feel safer today? What is it, April 16, as opposed to what was going on back in March? We don't have a vaccine. We don't have any treatments. We've succeeded in flattening the curve by staying home. We're asking people to wear masks. But the dynamic hasn't changed in a substantial way. So I just would pose that question. And for all those people talking about let's just open up the country, open up the economy, I ask you, what has changed? And with that, I'll stop. I'm sorry, I talk too much.
No, we appreciate your insight. This has been a really difficult time for all. And I think in the midst of it, we're all trying to find some silver linings in the clouds. What have been your silver linings?
Oh my goodness, many, truly. I have gotten to know a lot of the ICU docs in this part of the country. I had the privilege and honor to be able to knit together a group of physicians that extend from here in town all the way to the Appleton Valley, Oshkosh, and all the way to Illinois. And I've gotten to know some really wonderful individuals. We do this over Skype. We do it once a week. Every Wednesday we meet. It's about an hour meeting where we exchange ideas and thought and experiences. And I've gotten to know some really wonderful people, very dedicated docs, amazing. I have seen an incredible side of my nurses. I have seen an incredibly brave and compassionate side of this community, which again does not surprise me. I have seen competitors in our business, the different healthcare systems in this town rise to the occasion and collaborate very effectively in a very, very positive way. So yeah, I've seen a lot of ingenuity. I've seen a lot of humanity. So there's a lot of, it's more than just aligning. It's a big frame.
More than just aligning, a big frame. I like that. Is there anything you'd like to add or leave our listeners with?
Yeah, as you were staying home and getting frustrated with this whole situation, I understand. I fully understand. I grew up with the financial hardship. I'll be honest. It was very difficult, and I grew up in a different country, and I totally understand and can relate to very hard financial hardship. I get it, and I understand that. And I understand what is being asked of them to stay home, hang in there. I understand that. I understand it's very, very tough. But I want them to trust me when I say that you are saving lives. You're saving my life, truly, and others, by doing this. It is not a simple act to be able to adhere to this advice. I know it's not. It is asking of a great sacrifice. And I just ask that they do that. Because I'd like to see my child soon. So that's all I ask. I'd like for them to consider that. I'd like to consider and think of the nurses who also have families and children whom they're either sleeping in different rooms and completely sequestering themselves from them. The physicians out there, everybody who's involved in this effort. And just to consider that.
It's powerful. We're really, really grateful, deeply grateful for your time for this episode. More so grateful for your work and the work of everyone in healthcare in fighting the COVID-19 pandemic. And I hope you get to see your child and give them a great big hug very soon, Dr. Alshahouri.
Thank you, and I hope so. I truly do. That'll be a great day.
And thank you to our listeners. Please be sure to check out our additional episodes of Plug into Health, which are focused on helping you all stay healthy, informed, and inspired during the COVID-19 pandemic. Stay well, everyone.
You've been listening to Plug into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at prevea.com. Thank you for choosing to plug into health with Prevea Health.